we say research has certain that qualify it to be research. Initially said that research is systematic. It is meaning that it starts from one point and it can either build on positive data or negative findings, whichever information that we have. Then we have also said it is reductive, meaning that the many problems can be broken down into smaller manageable sub-problems. And then we said that it is replicable, meaning that if you do a research in Kampala, you can go and replicate that research in Arua. You know, we have seen the example of the circumcision trial in Rakai. Some trial replicated in South Africa and Kenya, and so many other studies have been done about circumcision. You know, it is transmittable, meaning that study findings can be applied in new settings. Now we can get the information from here and then we can apply that. If we find that the intervention that we're giving, let us say that you are distributing condoms in the toilets in Kampala, and people are consuming, and the uptake and utilization of condoms has increased. We can as well do the same in Arua, in Barara, wherever, and put condoms in toilets and to improve on utilization of what? Condoms. The other thing is that research is cyclical, meaning that research does not end with finding solutions to an identified problem, because when you solve one problem, it leads that the solutions of that problem will generate more problems along the way. Let us go to Paul, for example. Chirumina had a problem of cold nights. He was always suffering coldness and said, okay, how do I solve this problem of being lonely? So he decides to say, okay, I think the solution to my loneliness is to marry. So he brings the woman in the house. Paul, did your problems end? They never. So after bringing the woman in the house, now you have not. So you find that you have not been quarreling because you're alone. Now you have the opportunity to quarrel. You have your budget has changed. You have been eating one chapati chikomando per day. Now you're going to be buying 2 chikomando. So the budget has increased. So you find that more issues arise along the way. So after that, okay, now that you're 2, you begin to look for a child as a solution to solving your social issues. So as you get the child, now we do research. We identify even more things that require further research. That's why research is cyclical. We begin from one point and there is no ending point. There's no starting point and there's no ending point. Okay, then the last thing is that it requires data and interpretation. Someone should not come and say, yeah, human, I've done research on you and produce the data, give me a list of the facts from data. So there must be data collected and not just simple data, that not just rumors, it has to be serious data, and that data has to be interpreted in that context. So let us talk about application of research. So what about now in healthcare? Now let us come to our medical setting. In public health, where do we apply research? What are the different ways of applying research? Let us start from Namulesa Sarah, and then we come to Muhammad Ali. Prosi, you didn't talk. Namulesa. I don't know how to pronounce your name, either Namulesa or Namulesa. Are you there? Okay, Sarah seems to be packed in our classroom. So let us get from maybe Balandina. Application of research in public health.
Yes, thank you, sir. Good morning, sir. One of the applications is in finding out about the use of new drugs or vaccines.
Yeah, and even before they use, you first have to develop them. So how did the COVID vaccines come? was about research. So it begins from development of drugs, development of vaccines, and then testing them and using them. Okay, good. Look, we are Robert.
Yes, please.
We talk to us.
Yes, please. I just log in now. I'll repeat the question first so that I can respond.
Application of research in healthcare.
Okay, thank you, sir. Application research in healthcare setting. It helps us in innovation of new vaccines. Like we see the many trials which are being done, like currently the one for HIV. So we also intend to do research on all those stages to see if its efficacy it's actually it's beneficial to the mankind. That's why research also plays a very key aspect in the healthcare setting in respect to vaccine development.
Any other?
It also helps actually us in healthcare setting in coming up with a definite modality which will help us to ascertain how the staff may be behaving towards the patients. Like for instance, you find that some staff actually tend to be about having negative attitudes towards other patients. To draw all those conclusions in healthcare setting, research can be done to find out why staffs are behaving in such manner towards the particular patients at large.
Oh, good. So in a nutshell, we want to study the quality of care. We want to study the quality of care that is either offered. Okay, good. Lubega. And then Lokut.
Yes, good morning, sir. Yeah.
Good morning.
We are talking about application of research. Research can be applied in disease outbreaks and their effects. Take, for example, if there is maybe a disease in a specific area, we need to make research to find out which kind of disease, what causes it. In the process of surveillance, I think we can also draw a research to get more information about that disease. Then also, we use research in healthcare delivery to find out healthcare delivery, maybe in the community or in the facility. How is it delivered, the effectiveness and the utilization of those kind of services in relation to health. Thank you.
Okay, good. Fine. Lokut, finally.
Yes, thank you. We also do research in order to discover or find out why maybe certain people are behaving in a certain way. Give, for example, a lifestyle of a student. Why do students cause strike? Or why does strike take place in a particular setting or in a school? So you do research in order to establish what could actually have caused that, who could be responsible of it, and then later on you analyze the situation and you find an intervention to it. So discover and then identify a solution to a problem.
Okay. So there are a number of reasons as to why we do research. You know, I talked about drugs, surveillance, and epidemiology. Even the interventions, we want to know what is cost effective and what is not cost effective. Monitoring programs, you know, government comes up with programs and want to evaluate whether those programs are actually producing an impact in the community. Uptake of services, people have been complaining about uptake of COVID-19 vaccines. You know, why are people not taking up the services? Then, of course, new technologies. When the new technologies come on board, we have to evaluate whether these technologies are fit for purpose. Then, of course, we have talked about perceptions. You know, there are quite a number of reasons. Epidemiology, healthcare services. I think that's a repeated slide, sorry. So this is the research process. We plan, you do the research, you collect data, you evaluate, reflect, go back. You do the research again. We've said the research is cyclical. One step leads to the other. So now the research process has steps. And this one you must... Come here, why don't you meet your sweetheart, Jolie?
Becca. Inquiring, which DFC you up?
Okay. So this is a must know for all of us. Must know, underline, capital letters and bold, the research process. Every research begins with a problem. All researches start with a problem. Anything that triggers your mind and asks a question, that generates a question from your head and needs a solution, is what we call a problem. We'll discuss more about this. And then after that, we will be required to. So we will identify that there's this problem. So when we get that, when we know that, yes, now there's this problem, after you have identified the problem, you begin to do extensive literature review. Review literature to find out whether what you're actually calling a problem is a problem, you know? So literature review is about you now going out further, find out more, understand and refine the problem. Because sometimes you might think that what is the problem is actually not a problem. You know, the problem might be that you are the one who is ignorant, you know. And so after that, we now want to go collect our data. We want first, before we go collect data, generate hypotheses, objectives, questions. And then you get an architectural design. Just like you're going to construct a house, you realize that your problem is not, you have no house. So then how do I construct a house? What type of job do I need? Where do I get? That's literature review. Where do I need to get a plot? And then you now, okay. From that point, you now get your objectives and say, okay, by the end of this 2022, I should have got at least bought a plot and put a brick or two. Then you go to the designers, to the architects. Go to the architects and do what? And they give you a design. Even in your mental picture, you have a design. I want a house with 5 rooms, 10 rooms. Now, Nanyanzi and Christine, you want to break my ears? Please mute. Chonghang and Nanyanzi, why don't you mute your mics? Derek, maybe you'll be helping to mute some of these people who are disturbed by network. They join in and they forget to mute. So you'll be muting them from your side. Okay, thank you. So after getting the design of your house now that you want to construct, you now look for the money. Now in research, we determine the sample size. How many people do you want to interview? How many people, where do you want to go? Which population do you want to collect your data from? And then eventually you're going to collect this data, you analyze the data, you test the hypothesis, if you had any, and then make generalizations or interpret, then eventually you disseminate your research. Now, step number 7 is not found in certain levels, some types of research, as we shall see. If you're doing qualitative research, then number 7 is not there. Step number 7 is not there. So different authors give different processes or steps, but the core steps remain the same. Okay, so when you're going to conduct research, you begin to ask yourself a question: what's the problem, and why should it be studied? Now, right now, we have a problem of increasing price of soap. Now, why would we even bother to know why the price of soap is increasing while the price of salt is not increasing, for example? No. So what questions do we answer? Who are we going to ask even these questions? You know, what type of information do we need? Where do we get this information? And then eventually, after that, we go collect our data. So quite a different number of questions that you should first ask before you go and collect. Otherwise, you might go in the field and you find that nobody knows what you're looking out for. Okay. Any question up to that point? Okay, so we will talk about the types of research. What are the different types of research that we know? We are now going to, we have finished Lokut, so we are going to Chomhangi, Christine, Sharimpai, Kayevire. What are the different types of research that we know?
Yes, good morning. This is Paul.
Yes, Paul.
We can do a qualitative research. We can also do a quantitative research. And then also there is a mixed research where both quantitative and qualitative are used.
Okay, thank you. Sharimpa? Yes, John Hangi, go ahead. Christine.
Yes, good morning. This is Christine. We have action research and the descriptive research.
Okay, thank you. At our age, all answers are correct. Kamukama. Kamukama.
Yes, sir.
Yes, what are the different types of research? We have mentioned a few, add more.
We can have epidemiological research.
Okay.
Or analytical investigative research.
Good.
Okay.
Julia Zopolo, do you want to add any type of research apart from the ones we have mentioned?
Yes, please.
Yes.
We can have a cohort study, a type of research where we enroll a specific number of a population and study it over a number of years for different variables. We can also have action research. This is typically used in educational settings to perform certain principles and do conduct some self-assessments. Those are the very ones I can mention for now.
All right, thank you. So we have mentioned almost everything. So research can be classified in different ways, 3 ways. Classify research by purpose, by process, by outcome. So if you classify research by purpose, then we can say that we have exploratory research, descriptive research, analytical research, predictive research. If we classify research by process, then it's either quantitative or qualitative. So if we classified research by outcome, then we can have applied research, basic research, which we also call pure research, and then action research. So at this point, I will take some minutes explaining this slide and what this means one by one as you follow, take notes. Eventually, whatever I discuss is what matters. Do you remember the other teenagers? we learned in over P5, P6, John Speak and Richard Burton, who came all the way up to Ginger and discovered the source of the Nile. As if the Basaka who were there had not seen it. So, exploratory research is finding out new things to explore. You're going to virgin areas where not much information is known. And so those teenagers, they did not know. They were just, the Egyptians used to just know that this water is flowing from that side. But they did not know where the water was coming from. And so they decided to take a venture to go and find out. And then they come and say, okay, now we have seen it, and they make a write-up. So we want to discover new things. That little is known about. When nodding disease first came, little was known about nodding disease. And so ethnographers, different kind of researchers went to the north to try to explore much about the nodding disease. Similarly, COVID, when COVID came, little was known about COVID. We did not even know that putting on masks was protective. So people go and find out more information about a certain phenomenon that has occurred. So in this regard, in exploratory research, going into finding out opinions or perceptions of people about certain things. So it is the first basic form of research that is always done. And this form of research leads into the generation of an hypothesis or a theory. You know, we generate theory out of this, because how did we know that a good Muganda woman to marry is from Masaka? Perhaps people went there and did an exploratory study and studied those young girls in the villages of Masaka, and then looked at how they behave, and then they came up with a theory that if you want to marry a good woman, go and find one from Masaka. That is a theory which needs to be verified and tested. So exploratory research, I've said, we are going to explore into areas where little or no information is known, where there is gray data. And so we want to seek out on opinions or perceptions of people, what they think about this. And then at the end of it all, we're able to generate a theory or a statement that summarizes what we have found. So exploratory research in most of the times is qualitative in nature. It is qualitative. Okay. Feel free to interject along the way. So we also now go talk about descriptive research. Now, eventually, all this type of research, this description, these words, they come from the actual English words. Exploratory research is to explore, finding out something new. No. Descriptive is to describe. And describing means paint a picture. If somebody told you, somebody was asking, do you know Mr. Jaru? I was like, could you describe him? So if they tell you to describe me, then you'll be like, oh, that lecturer is a tall guy, is a black guy, he has a very deep voice, you know. So you're trying to paint a picture about me to somebody who does not know, much about me, who has never seen me. So in descriptive research, we want to provide a picture of what is happening in the society. We do not know the prevalence of malaria in village X. So we go there and we get people and ask them, Nyabo, do you have malaria? Yes or no? Sebo, have you ever suffered malaria? Yes or no? So at the end of it all, you interview 1,000 people, and then you come back and tell the DHO, Mr. DHO, in this village, the prevalence of malaria is 20%, because out of the very 100 people, 20 of them have what? Malaria. That is describing the situation as it appears, without adding any intervention. You can as well add and say, you know what, in this population, I've seen that it is mostly the women and children who are suffering from malaria. So in descriptive research, we're answering questions like what, when, where, and how much. Whereas in exploratory, we're just asking one question, what? Actually, two questions, what and where. What is happening and where is it happening? In descriptive, we're asking a number of questions. What is happening? Where is it happening? How much of it is happening? And when did it happen? Those are the words that try to paint a picture of a description of a phenomena. So the next form of research, analytical research, can build from a descriptive research. Now, the analytical research is asking the question, why? Why? In addition to what, when, where, and how, it's asking the question, why? So we go to this community. We have 10 minutes to break up again, then we come back. So we go to this community and asking the question. Collected data about malaria, and then okay, 20% of the people have malaria. Most of the people are suffering from malaria are young children below 5 years, pregnant women, and then smokers and people who take alcohol. Then you find that malaria was low among the young people, and was more among these people who live near the wetlands. That is descriptive. Now the question about, now when it comes to analytical research, you want the question, why? Why is it that in this population, it is children below 5 years who are suffering from malaria? Why is it that in this population, it is smokers and alcoholics who are more affected by malaria? So now, analytic now goes a little deeper and further to provide an insight of the why. Why is the situation happening like this? You know, if it was in a family background, for example, exploratory, if I would use an example of marriage, exploratory, I would want to know, just want to know about this woman, know about her character, know about this and this and that. Then I give a description. I say, describe, oh, my wife is short-tempered. Oh, my wife is hot-tempered. My wife is humble. My wife, that's describing her. No, my wife is a hard worker. My wife is this and this, you know, telling somebody how the person appears. Now, if I want to go to now to become more analytical, why is it that this woman is so hot-tempered every time I ask about her salary? You know, you want to now go a little bit, a niche further. Why is this woman so much a hardworking person? Does she want to prove to me that she can live without me, that she can be independent? Asking questions, going to ask the why questions. That's the analytical. And so in the analytical research, we are using the words such as relationships, association, factors that are associated with this. Then what are the factors that are associated with prevalence of malaria in community X? What is the relationship between young age and the prevalence of malaria? Now that is analytical. Meanwhile, for descriptive, we are asking questions like, what are the factors that are affecting the prevalence of malaria? Or factors that are influencing the prevalence of malaria? Factors that are contributing to the prevalence of malaria. That is descriptive. It is just asking what. Now, when we come to analytic, we want to now ask, is there a relationship between being a baby and the prevalence of malaria? We want to get associations and relationships. Are we together? I'm discussing these things slowly and going back and forth, and I'm repeating myself every now and then. Now, we go to this predictive research. Predictive, just like the word to predict, to tell the future. What is the Uganda's population by 2050? Okay, for example, you can say by 2050, the population of Uganda will be, let's say 80 million people. How do we come up with the 80 million people? We look at the fertility rate, current fertility rate. We know that the current fertility rate in Uganda is around 7 point something, for example. And if we take that fertility rate with the population that we have, that means that by 2050, we're most likely going to have 80 million people. Predicting the future. So even at home, when you see a certain behavior, you're most likely going to know that, the way this woman is acting, most likely she's about to chuck me. No? So we want to use the previous facts. No? Using the previous facts or the previous information, combine it with the present, such that we're able to predict the future. And so that is the predictive research. So in predictive research, we're asking, what is the likelihood that by this time we are going to have 80 million people, basing on the current information that we have? Okay. Are we together? Bernard. So what have I said? Immaculate, Alupo, what have you understood from my discussion so far?
Wow. I must appreciate that the discussion was quite. I would like to begin from the research side, predictive, and say that actually say that under this type of research, we use previous information and then present in order to be able to forecast the future of the predictions of what is like. No, I'm not using headphones. Okay, maybe it's your volume.
Maybe network is just poor. Okay, thank you. At least you have got something. Adiao. Flavia, Adiao.
Yes, sir, good morning. Okay, what I've understood, you talked about exploratory research. This is like we are trying to discover new things, exploring something. That's like from the word itself. They're like this research, you can describe them based on the word itself. Now, like for descriptive, you can, like when you, why are malaria cases increasing in this village? So you're going to describe why malaria cases are increasing in that village. So in your research, you're going to give different ways why malaria cases are increasing in village. Then you talked about predictive. It's to predict for the future. In 25 years, what is going to be the fertility rate in Uganda? How fertile are women going to be in Uganda, if I may use an example? And how do you predict the population in Uganda to be in 50 years from now? So that they in order to predict that, they use predictive research. I submit.
Okay. Finally, let me balance the boat. Bamuleke, what have you understood from my description so far?
From what we have learned about the types of research, I've learned that we can categorize them according to purpose, and under that, we can look at the exploratory research, which simply means to explore and find new things. Then for descriptive, it intends to answer questions like, what is the problem? Where is the problem? And who is possibly affected? Then for analytical, it seeks to understand why is it that it is that particular group of people that is affected. And you find out the narrative about